Hi, welcome to FitTech Videos. Today's video we're going to focus on the advanced partner assisted triggers, and in this video I want to focus on a very common thing that I get in my practice, and that's tension headaches and neck tightness. So in the previous series of 20 videos we focused on every muscle individually. Now I'm going to focus on the group of muscles that you focus on for neck tension or tension headaches. So the first thing I would do, before I continue, thanks to my wife Marby, continue helping us with these videos. So the first thing I would do when a client comes in and complains about tension headaches or neck tightness, or even a stiff neck or a spasm neck or anything like that, the first thing I would do is work on the forearm. So as we've done in the past, in the other videos, we use hand towel to go over the arm. So what I'll be doing is I'll cover the arm with the towel so that I can get better grip. In this case I'm going to show you without the towel, but I would use the towel always. So just relax, make sure that your client doesn't shrug up. The most important cause for the tightness of the neck and causing tension headaches is because this whole area here is super tight. So if you're holding the arm as Marb is doing now, she's tensing her trap. So what you do is you ask her to relax. If she battles to relax, then you ask her to shrug the shoulder up and relax down. That'll instantly help her to relax. Do you feel that's much better? Now, stay relaxed, good. Then what I'm going to do is I'm going to grab hold of the arm, add a little bit of twisting and a little bit of up and down movement. So you grab hold, so you can go from the medial side to the lateral side, from the lateral side to the medial side. So lateral just meaning outside, medial meaning inside, closer towards the midline of the body. So just in there, and then you can work all the way through. Remember, the bottom side is also very important. So you can do it, just relax again, shrug the shoulder up and relax, good. You can do it from this angle where you grip your thumb, just relax. You can grip your thumb on top and your forefinger at the bottom and working it. Or you can do this movement where you bring it up a little bit, shrug up and relax, always making sure that trap's relaxed. Hold on to there, and then you can work with your thumb. Remember, I'm always going to work with a towel, but I'm showing you where the thumb is. And then you can work in this area, pushing on it and asking her to, and you can add a bit of rotation, so add some rotation and up and down, and you can feel that's a good way to get in. So that's where I'll start, straight away onto the forearms. Then I'll jump to the biceps and tricep, because the bicep attaches right up here in the shoulder and it helps with rotation. And if you release the bicep, you've got to release the tricep, because they're antagonistic muscles, so they'll work on each other. So you want to always release both. So again, cover the muscle. In this case there's a sleeve, but it's very short, so I'll cover the muscle with a cloth. In that position, always make sure you shrug up and relax. You're going to grab hold of the muscle and work it. Very good. So again, I'm taking away just for the purpose of the video, but I'll always work a towel. Just relax, always work over a towel, and then you grip the muscle, make sure that it's not too tense, shrug up and relax, good, and then there, and then you're releasing it. What you can also do, I'm adding some movement, or I can come in here and ask her to do the movement. And that you do both sides, tricep, bicep. Fantastic. Now, you're going to go into the business end. This is where a lot of it's happening, a lot of the tightness. But when you've released the forearm, automatically the trapezius muscle is a lot looser and it's more willing to release. Now what you can do, always do a little bit of stimulation. Remember, you never have to push too hard. It's not about hard, it's about how deep you can get in, and not about how deep you can get in, how deep the body allows you in. So in order to get deeper, I don't go harder. If I go harder, the body pushes against me, causes tension, makes the problem worse. So what I do is I add a bit of movement. So in this case, I feel it's very tight. So when I start then I think, whoa, that's quite tight. Then I'll ask her to shrug up and relax, and straight away, as she relaxes, straight away able to go deeper, right? Not harder, deeper. Great, so you warm it up, and then just go a little bit to the side, just twist so that I can show the camera, sorry. Okay, so in this side, so you're going to go under the scap and onto the trap here, and then you can warm up under the scap here. Yeah, turn all the way, there we go, sorry. There, so then I can work under the scap. Now what you can then do is you can go onto the trap, and then once you've warmed it up, this area here, then you're going to go and ask her to shrug up and relax, and as she relaxes, you push in and then turn the head this way. Good, so you turn the head to the opposite side and relax. So you go again, you find another spot. Again, you don't have to feel the spot. Let your partner tell you where there's a spot. That's quite a good spot. Then shrug up and relax. And as you relax, as you push ever so slightly harder, and then turn the head and you're gripping it. Good. That's a good way. Then you can get her to take this arm, put it on the opposite shoulder. That opens up the scapula and you can go into the scapula. Again, remember, not too hard. Just a little bit of stimulation. And the faster you go, the deeper it actually allows you in. So you don't have to go hard. You can get nice in and out. Then what you can do, just put your arm straight up like that for me. Now you can ask her to push the arm forward and come back. Good. So what you can do is you do a little circular movement, grip the muscle, push forward and relax back. Straight away that movement helps. Relax the arm down, straight. Now, want to lift the arm straight up. So you grab a spot, lift the arm straight. That movement helps as well. Very nice. Great. You can come facing the camera again for me, please. Just to that angle, remember? Okay, we'll go to that angle then. Go there. Slightly, a bit more this way. There we go. Now, sorry, we're just adjusting so I want you to see nicely. So what we then do is you also want to release the chest. So what you're going to do with the chest is you're going to come in here, a little bit of stimulation, and then you're going to grip and pull away. So stimulation, warm it up a little bit, then you're going to grip, pull away, and ask her to turn the head away. That's stretching the pec muscle, and relax. There, stretch, pull away. Now what she's going to feel is a little bit of a skin pull. That's what you want to feel. It shouldn't be too painful, but it's going to be sensitive. If it's too painful, just back off on how much grip you're giving. Then what you want to do is you want to go into the lat muscle. So you get her to hold like that, and then come down. Good. Come up again. And you get her to move a little bit so you can feel where that lat muscle is. Now you hold on there, and you ask her to pull down. Pull down and pull up again. Go up. Good. And relax. Then you relax. Now pull up now. And as she pulls up, you pull down, releasing this lat muscle. Because the lat muscle helps to rotate the shoulder, which then puts pressure on the neck and pulling you around. It puts tension in the neck and can cause tension headaches. Now you want to go into those scalenes. Very, very careful when you go into the scalenes. The scalene is just, if you feel your collarbone here, it's just on the inside of the collarbone. And you feel your big trapezius muscle, it's between the trapezius muscle, the collarbone, and this neck muscle that attaches onto the sternum here. So all you're going to do is ask your partner to take a deep breath in with your fingers, just 2 fingers in, just inside the collarbone. Take a deep breath in for me and relax out. And as you relax out, you slightly push in and ask you to turn the head away. Fantastic. And relax. Then you get it to take a deep breath in again and relax. And as she relaxes, you're holding. This time you can pull slightly away. Remember, everything is done very, very slightly. Your partner must constantly feel, you can relax it. Your partner must constantly feel comfortable with the pressure. Obviously, it's going to be a little bit sensitive, but it should never be sore, never be unbearable. Rather build up. If it's very, very sore, especially if your partner's woken up with a stiff neck, spasm neck, you go through this, starting at the arms, working through all of this, slowly releasing a little bit, and then you get to a therapist that can help you more. Hope you enjoyed that, and thanks for watching.